We want to honor God because He sees everything.
You were born with a plan and a purpose. He's the God of all things possible. He's the God of all miracles.
Welcome to Grace with Nina Michelle. I'm Michelle Humphreys.
And I am Nina Keegan. Welcome to the broadcast today. You are going to want to hear this broadcast today. So call your friends because we have two very, very important guests on with us today. Doctors that are going to talk to us about some new and exciting things and how to stay well and healthy. So Michelle, you want to introduce one of them?
Yes, I do. We have with us a fellow of the American Board of Physical Medicine and Rehabilitation. He is the founding medical director of Southeastern Medical Center in Sunset Beach, North Carolina. He is an expert in the field of orthobiologics, treating chronic soft tissue and joint disorders, including stem cell injections, platelet-rich plasma injections, and prolotherapy. So for more than 28 years, he has performed interventional pain procedures. Will you please welcome Dr. Henry Lepore? Welcome, Henry. And we have another doctor that Nina is going to introduce. We're going to have our very own version of Ask the Doctors.
Yes, and this one just happens to be my husband, and I'm super proud of him. It's Dr. Richard Klucknik, MD. He is a fellow of the American College of Radiology, also a fellow of the Society for Neurointerventional Surgery. He is board-certified interventional neuroradiologist with more than 35 years of experience, skilled in the endovascular treatment of aneurysms, arterial venous malformations, vascular malformations of the brain and spine, and strokes. And he's gotten his medical degree from Tufts, and I could just go on, but we need to get to this show. So welcome, guys, and we are so grateful to have both of you on. You guys are so highly experienced in your medical fields, and people just need to hear what is new and happening. So Henry Lepore, Dr. Henry Lepore, we want to start with you. So he is a good friend of ours, he and his wife, and so I know this man, and he is a man of just brilliance, and just love to hear what he's got going on these days. So tell us what's new in your field, and what are patients mostly coming in and needing?
I'll tell you, right now, my patients are most excited about the mesenchymal stem cell derived embryonic tissue from umbilical cords. That's the biggest thing going on right now for treating inflammation and joint pain and spine pain from umbilical cord, live birth, placenta derived cells. That's one of the biggest things right now. Also, we find that we were getting a lot of questions these days from.
What type of results are you seeing?
In these patients that do actually get the treatments here at our center, they actually get anywhere from 50 to 80% pain relief over a period of several months. So we're quite excited about that, and so are the patients.
So what is like the process of that? Like, what do you do to how many treatments? What is typically that like?
Well, we have the patients come in and we ask them, have they tried other conservative treatments like injections? And some of these patients have undergone orthopedic surgeries also, and they've been less satisfied with those treatments. So we offer them these mesenchymal stem cell derived umbilical cord prenatal tissue treatments. And the way we do it is if they have soft tissue problems, maybe tendinitis or maybe a joint pain that is from arthritis of the joint, for example, then we could do a local injections of these mesenchymal stem cells right into the area where the pain is and the inflammation. And they may also have scar tissue there. So that would help with the healing process, reduce the inflammation over a faster period of time than most treatments. If they have an autoimmune disorder, for example, like rheumatoid arthritis, or for example, they may have a peripheral nerve problem or a central nerve problem, then we may suggest that they have stem cells that are infused. We may do an IV infusion for them, and we may actually have them in the office for 60 minutes. And by doing that infusion, it's amazing how these patients feel afterwards. They have more energy because they're getting these young cells from these umbilical cord prenatal tissue that have the mesenchymal cells. And these cells are growth factors. They help with inflammation, and they also boost the immune system. So we offer that for them either by IV infusion or by peripheral injections.
So are these people in need of like physical therapy afterwards, or do they just keep coming in for those, or what is like a typical patient? Like if they're seeing relief, do they come back at a certain point, or
Yes,
what happens?
they come back for comprehensive treatment. We like to use physical therapy, and we like them to come in for at least several injections. So they may come back after 2 to 3 weeks, and they can receive another infusion, or they may receive another peripheral injection with the stem cells. So we like them to have come back, and we also discuss how they're doing. If they're doing well, then we continue with that treatment and also suggest they increase their function by going to physical therapy, for example, and also make sure they have a healthy diet. We also encourage them to increase the intake of vitamin B12 and other vitamins to help along the healing process and to decrease the inflammation.
So you're using natural means as well as these very different types of therapy. So what does the typical person that walks through the door of Dr. Henry Lepore, what are their ailments? Like, who goes to see you?
Most of the patients that have seen me, they have chronic pain conditions. It could be due to arthritic conditions like osteoarthritis, or it could be due to autoimmune problems. For example, inflammatory autoimmune problems like rheumatism, like I had mentioned before, or it could be simply tendinitis, soft tissue injuries. And these are patients that have tried conservative treatments, but they're not getting much from the treatments. So they end up here, and we try to offer them different treatments that are natural and benefit the patient by trying to help them with their problem, try to solve the problem, as opposed to have them keep not continuing doing what they've been doing in the past, for example.
Well, I'm sure that you are their favorite doctor if you are relieving the pain. And we are going to talk more to Dr. Henry Lepore and Dr. Richard Klucknik when we come back.
When I started MyPillow, it was just a problem solution, one product company. Well, since then, with the help of my dedicated employees, we now have hundreds of products, some you might not even know about. To get the word out, we're having a $25 extravaganza. 2-pack multi-use MyPillows, $25. MyPillow sandals, $25. And for the first time ever, our 6-pack towel sets, you guessed it, just $25. Our brand new 4-pack dish towels, $25. And I've never done this before. Premium MyPillows with all new Giza fabric, any size, any loft level, even king size for only $25. And there's so much more. So go to MyPillow.com or call the number on your screen. Use your promo code for our $25 extravaganza. Order $75 and over. Your entire order ships absolutely free.
Welcome back to Grace with Nina and Michelle. We are here talking to two amazing doctors that are just really highly specialized in their fields. And just, you know, we know that the Bible talks about it over and over again about how God heals and he wants us well. But he's the greatest physician, but he also uses the very skilled hands and brains of these powerful doctors here on earth that have such amazing protocols lined up. So thank you, Henry. We just are so grateful for your expertise and for sharing that with our audience. And so Dr. Richard Klucknik, so tell us about what you do. We know that you're one of your biggest areas of expertise is strokes and aneurysms. So what are the signs of strokes and what should people do when this is going on?
Yeah, so we have to define what a stroke really is, and there's basically two types of what we think of as stroke: is a bleed in the brain, or what we commonly think of as a stroke, non-hemorrhagic, where a clot comes either from your heart or from other part of the body and goes up and gets stuck in your brain. That's what a stroke is. Once that clot hits the brain starts to die. So you have a limited amount of time to do something about that. So basically, what do you have to do to define a stroke first? And there's a good mnemonic that's out there that we use, and it's simple for basically not only yourself, but for family members and people around you. It's B FAST, B-E-F-A-S-T. B for balance. And it's more important for family members because they're the ones who'll see somebody. All of a sudden, we've had patients that were walking and all of a sudden they're hugging the wall and they say, "What are you doing, Dad?" He's hugging the wall because he can't have balance anymore. Eyes, disconjugate gaze, your eyes will go crazy, a little bit off. F for face, facial droop. That's a very common thing that people will notice about their loved ones. Their face starts drooping. And then we say arm, basically strength. You lose your strength. People pick up a cup of coffee, they drop it, or they can't pick up a cup of coffee. And then speech. Speech is a common one. All of a sudden, even people on the phone with loved ones, they'll notice that all of a sudden they're slurring their words. And the last one is time, because time is brain. So you have to basically think you're having a stroke and call 911 and get to a place that can treat it. Now, that goes to treatment because for many years we were trying to treat stroke and we didn't have things that could get it. But about 10, 12 years ago, there were some new studies done that were new devices. And we were able now to get up, go from either the artery over your hip or artery from the wrist, and we can go now up into the brain and pull that clot out, either a device that pulls it or we have a vacuum cleaner. Basically, it sucks the clot out. And once we did that, we've turned the paradigm against stroke. We've turned it to where cardiologists used to, they're the heroes for heart attacks, and they have what's called a STEMI, is the fancy word that when you use that term, it means you're having a heart attack, and everybody immediately jumps in and you can save the heart. Well, we came up with a term called ELVO, emergency large vessel occlusion. In the society, we're trying to think of the same thing that cardiologists can use because we want emergency room people, EMS people, everybody to be on the same page. If they go out in the field and they can diagnose that there's a stroke, it institutes immediately. You get that patient to the best center that you possibly can that has somebody like me or somebody like that that can get that clot out. And we came up a long time ago with ELVIS, which is emergent large vessel ischemic stroke. And we thought, well, Elvis Presley and that all kind of stuff, that probably wouldn't work. So we got to come up with something else. So we came up with ELVO, E-L-V-O. So we know that when that word is used, EMS and basically it's a whole cascade of things that happen when that word is used. And I work for the Society of Neurointerventional Surgery. We work with a place called Get Ahead of Stroke. So we're working with state legislatures to get out and get the EMS people to go out and instead of bringing it to a local hospital where they languish for a little while before they get transferred, is to bring those patients immediately to a comprehensive stroke center. And you have to use those words, comprehensive stroke center. As the Pat Robertson family knew that, she had a stroke and she wasn't brought to a comprehensive stroke center. But when Pat Robertson had a stroke, he was brought to a comprehensive stroke center and they knew exactly what to do. And therefore, he didn't have a severe stroke at all.
He went back to work.
He went back to work.
Worked until he decided to go to heaven.
Right.
Yeah.
So, but isn't it like a law that the ambulance, if it's coming, like has to take you to the closest medical facility? And isn't that the law you're trying to change?
That's what we're trying to change.
So sometimes if you notice a loved one's having a stroke, isn't it just better to maybe drive them, find out where your comprehensive stroke centers are, and drive them to that facility yourself? Wouldn't that be more beneficial if the law has not been changed where you live?
That is true. That we're trying to change. That's what we're doing state by state, trying to change that law, because you're right. Most EMSs will go out and they can diagnose it, but they'll get them to a local hospital first. So we're trying to change that to make it a law. No, you bypass that and come to a comprehensive stroke center. And it is good for people to look up where the comprehensive stroke centers are. And the Get Ahead of Stroke program has a listing of comprehensive stroke centers. And the Society of Neurointerventional Surgery has a listing of people like so it'll list people like ourselves, the interventionalists who can go in and get the stroke. They're listed state by state by state. So you can look up those two things and find out where people can be treated. So you're right. Or drive. We have a story just happened last week where they sent a patient to a local hospital, and the next thing we're hearing, they don't have an ambulance. Like, what do you mean they don't have an ambulance to drive? And okay, we'll get a helicopter. The helicopter goes to the airport to get gas first instead of going to get the patient. So we were laughing that if the patients only knew, it would be faster to just put the patient in the car and drove down to us rather than languishing for 3 hours in this other small hospital.
Well,
so
like
we're
you
working
said, time is brain.
Time is brain. If we can get to patients within 6 hours, we have great success at getting that clot out. And basically, if you may not be able to reverse everything for the stroke, but they'll do far better than they were 10 years or so ago.
Well, and now that with this procedure, you're not getting cut open too, so the recovery is it's immediate. And
the recovery is much better. In the old days, 10 years ago, if you had a stroke and you couldn't do it, the brain would start swelling. You would actually have to take the skull off and allow the brain to swell. I know it sounds terrible. And then as the brain heals, you can put the skull cap back on. We hardly ever do that now. It's almost rare that kind of procedure has to be done anymore because we're so successful at getting the clot out and getting patients back up and back them up. They may have to have a little bit of rehab, but basically it's so successful that we need to get the word out so we can save more people.
Well, praise God. Well, thank you so much for that. That is amazing, both of you guys. We are going to come right back with more with Asking the Doctors. Stay right there. We'll be right back.
When I started MyPillow, it was just a problem solution one product company. Well, since then, with the help of my dedicated employees, we now have hundreds of products, some you might not even know about. To get the word out, we're having a $25 extravaganza. 2-pack multi-use MyPillows, $25. MyPillow sandals, $25. And for the first time ever, our 6-pack towel sets, you guessed it, just $25. Our brand new 4-pack dish towels, $25. And I've never done this before. Premium MyPillows with all new Giza fabric, any size, any loft level, even king size for only $25. And there's so much more. So go to MyPillow.com or call the number on your screen. Use your promo code for our $25 extravaganza. Order $75 and over. Your entire order ships absolutely free.
Welcome back to Grace with Nina and Michelle and our fabulous, brilliant doctors here on with us today. We are so grateful for them and their expertise. We just believe so many people are going to be helped through what they're saying today. So, Dr. Henry Lepore, we want to ask you, you were mentioning autoimmune, and I've even heard President Trump talking about how autoimmune is so on the rise right now, and so many people are suffering with these things, and how we know he's got, Robert F. Kennedy Jr. looking into these things. And so what do you think, since you're seeing a lot of this, why do you think that is on the rise now? And what do you think people can do to maybe ward off some of that, or what should they be doing to help themselves a little bit if they can?
Well, that's a great question. I actually saw a patient today, and she's been telling me how her headaches have gone away after she was diagnosed with autoimmune celiac sprue disease, and she has other autoimmune problems. And she was telling me how she eliminated so many foods from her diet, and how her headaches had disappeared. So a lot of the issues that we see in autoimmune problems have to do actually right down to our stomachs, right down to the gut. And so we see that diet plays a big role these days of what you're eating and how it affects your immune system. Either it could boost it up or could cause over inflammation, or it can actually suppress it. So diet has a lot to do with it. And for example, a lot of people get inflammatory bowel arthritis from seronegative arthritis. For example, ankylosing spondylitis, or they may have other issues that affect their joints and their overall health because of inflammation in their gut. The body is attacking their gut and is also attacking their joints. So it's really important that we follow a healthy diet and we eat the right foods, and we also try to lose weight. It's almost like when we have New Year's resolutions, we try to go to the gym, we try to lose weight, and all these things put together are very healthy. And especially this time of the year where we have the possibility of flu outbreaks, it's a good idea now to think about these things, to commit to weight loss, eating the right foods, and things like that. So we always emphasize that you have to be really careful on how you treat your body. And that means the amount of weight you carry around and what kind of foods you eat. So we do suggest that patients be aware that some foods can trigger hyperinflammation in your body, and certain foods are good to eat. For example, you want to eat salmon, which has high concentrations of vitamin D. You want to eat berries that have high concentration of vitamin C, and you want to maybe have some green tea with that. Or you could also have nuts, which have high concentrations of vitamin E. And also beans. I mean, high fiber is good for you, and that has a high concentration of vitamin B12. So it's very important to look at the diet overall and start a good exercise program and make sure that you follow through on it. And especially these days with obesity being so prevalent and increasing in our population, it's very important that these two things are addressed for a specific population, especially the autoimmune population that is subjected to so much insult from their own bodies, from their own antibodies sometimes, and cause a lot of joint inflammation, gut inflammation. So I
Dr.
think
Lepore, what are some of the top food offenders that you're talking about that trigger inflammation in your patients?
yes, there's a lot of foods out there. Anything that I see right now is over processed, super processed food, anything almost in the cellophane packaging, beware of. Anything that contains a lot of sugar and salt, those kind of things. And one should look at super foods. For example, like beets are very good for you. They have a lot of elements, not only vitamins. And for example, and like I said, all these foods like avocados, not only do they have vitamins, they also have excessive amount of elements like magnesium, for example.
That's
And
excellent.
so,
Yeah,
yeah.
those are some great suggestions because people, I mean, really, they they do say you are what you eat, and really, it is about your gut health. I've learned so much about that, about your, having that good bacteria, and that your body's able. It really is about your immune system too. If your gut is healthy. So it really does help with all the foods that we do have. So Dr. Klucknik, so what are some things that you think people could do to prevent strokes? Maybe some things that they need to be doing or watching?
There's a few simple things. Number one is diet. because if you have a bad diet, you're forming plaque in your arteries. If you have plaque in the arteries in the heart, you have plaque in your arteries in the neck and also in the brain. Smoking is a big one. Smoking, it causes all kind of problems, but the incidence of aneurysms is higher in people who smoke. And it's kind of leveling off in the United States because of our cessation of smoking program, but still high in Europe and China because smoking damages blood vessels. And high blood pressure. If you have high blood pressure, take your medication, because it's the blood pressure that may lead to aneurysm formation in the brain, because that pulsation hitting spots of the brain, your arteries in the brain aren't the strongest things in the world. God gave us a nice big piece of bone to protect our arteries, so we don't have muscle in those arteries, so they tend to be weak. So a simple thing, diet, high blood pressure, smoking.
Well, look, it's diet for both. It's like, isn't that about that for everything?
Or what you eat.
Because if you think about it, nowadays too, if you think about what they've contaminated all of our food and all of the chemicals and preservatives, things that are not allowed in Europe, and things that we are facing, and even just the sugar and the mass amounts of, in just a day, you ever see any of these shows where they show just, it's endless how much sugar people are intaking. So very good information, you guys. Dr. Henry, where can people find you? They want to know more about what you're doing. How can they find you?
Well, I would be happy to have people go to my website, southeasternmedicalpa.com, and they could find a lot more information there. And they could also call my office in Sunset Beach, North Carolina, at Southeastern Medical PA, and we'd be more than happy to make an appointment for them and speak to them.
Awesome.
Thank you
That's
so much.
awesome.
How about you, Dr. Richard Klucknik?
Well, currently, I'm at Advent Hospital in Tampa, Florida, and you can find me there on their website. I'm listed, and neurointerventional surgery consultants.
Awesome.
Thank
well,
you, doctors.
thank you guys so much. We just believe that people are going to be calling and wanting to know more information. And thank you for all that you're doing. We know, again, God uses powerful minds like you guys to help in his healing process that he has for people. God wants you healed. That's a fact. So thank you guys so much. God bless you for coming on.
Yes.
And we are grateful.
Does science disprove God?
Is there a war between science and faith?
RDOF uses logic and reasoning.
RDOF has empowered my sons to defend their faith with facts.
If you want to be equipped to defend against the biggest objections to the existence of God, RDOF is the place for you.
Has science really ruled out God? Is faith at war with science? If you want to be equipped to respond to these claims and more, check out RDOF.org.
The evidence he presents is so powerful and overwhelming.
Incredibly compelling, yet easily understandable.
We believe in rationality, we believe in reason, we believe in science, and we believe in the existence of God.
I would leave every event with a mind-boggling awe and assurance.
I never believed in God. I just think it was craziness. RDOF confirmed my faith. RDOF confirmed my full belief, full faith in the Lord, man.
The appearance of design in the universe is undeniable.
The lights, the crowd, the videos.
To book a presentation or watch our free videos, go to RDOF.org or find us on Facebook at RDOF Events.